Today I come here to show you a new method that has been existing for 3 years as a protocol. It's regenerative medicine to detain androgenetic alopecia. Well, let's begin by saying that regenerative medicine doesn't have a long lifespan. The first regenerative medicine that has been recognized will be the first blood transfusion in the 19th century. Then we continue in 1957 with the first bone marrow transplant, and we finish with cellular embryology in 1998. So we haven't spent that much time studying regenerative medicine. We've always talked about the usage of cells from the bone marrow and from fat. We haven't paid too much attention until not so long to that important source of stem cells and the vascular stromal factor that we have in the dermis, epidermis, and also the hair follicles. Very rich in vascular stromal cells. Progenitor cells from the microinsertions micrografts come from the qualification by flow cytometry. So much so that we have that 4 square millimeters, and after processing the dermis and the epidermis, we have a content of 70,000 cells approximately. 70,000 cells that have everything. They are cells from the flat muscle, because if we do a biopsy of everything that has 2.5 in the cylinder of the dermis and the epidermis, we can find all types of cells. But especially we are going to focus on a few of them, the petacytes. The parasites are those cells that are binded to vascular structures, and that not so long ago we didn't know what they were used for. And these parasites are found abundantly in all the vascular network. When we do an injury, when there's a vascular injury and those parasites detect them, they transform in mesenchymal cells until they become stem cells that weren't present as stem cells before. And they have the trophic capability to go back to the place after the injury to wait for a new injury. These stem cells of the vascular stromal system play 2 important roles that have been studied thoroughly. The first one is the trophic, the other one immunomodulatory. If we are able to do a micrograft in a damaged tissue from a healthy tissue to help them with these parasites of the donating tissue, will have an anti-apoptotic action or anti-cellular death reaction. Also, a restructure of collagen in a more orderly fashion, and a new angiogenesis. And once again, the predominant factor of every graft that we have, or of every regeneration, new vessels, better circulation, better oxygenation. And it's always going to be present. The immunomodulatory segment is going to allow for interleukins, or for the different growth factors, and the molecules that are expressed with that injury that are segregated by these cells will allow for the inflammatory phenomena to be better modulated. And everything that's segregated by these cells of the vascular stromal system is what's being called secretome. The secretome is all of this set of organules and cellular signals that will allow for this micrograft that we are doing to survive and to last longer. But androgenetic alopecia, which is what we're seeing, what are we going to do there? Regenerative medicine reproduces the same damaged tissue for another one that's the same. Unfortunately, the superior race to amphibians and reptiles, we're studying regeneration to see how it happens. It's more like a maintenance of the tissue. Only blood and the epidermis are tissues that are renewed and regenerated on a continuous basis. The other ones are maintained the same. That's why in the dermis and the hair follicles is where we have the source of regeneration. So just as someone thought that a normal sensitive zone of the scalp could survive in a hormonal sensitive zone because of the characteristics of that hair follicle didn't have the expression or the genetic expression in their cells, someone also thought that cellular information could be trespassed without doing the micro hair graft. And through a simple protocol that only lasts for 15 minutes in the office, and I've been experimenting with it for 3 years now, through a mechanical disgregation and process and not a chemical one, that micrograft that's extracted is processed in 2 minutes mechanically, and we obtain with the serum that we added a soup, a broth of cells that can be injected where we want to regenerate. In this case, in the zone of androgenetic alopecia, these micrografts are extracted with a punch at 2.5 millimeters, and this is how the pad looks like. And it contains the epidermis, the dermis, all of the dermal zone that has the hair follicle, and subcutaneous cellular tissue. We do this from the nape, a normal sensitive zone, because this zone, embryologically speaking, is related to the neural crest, and all the stem cells that are here are a lot more powerful than the rest of the body. Talking about the hair follicles, this zone is better than the armpit, than the pubes, than the beard, because everything has been measured and studied. Now I'm going to show you a small video where you will see the procedure to extract the micrograft, process it, and to insert it. And by doing this, we're able to delay androgenetic alopecia, among many other things or usages. It's set in Spanish zone. We're going to the temporary zone, to a normal sensitive zone, and we disinfect the zone. We try to be as sterile as possible. Then you shave the doning zone in approximately 2 square centimeters. We have enough to take out the 3 grafts. We put anesthesia with lidocaine without a constriction, because stem cells are very sensitive to vessel constriction, not so much to the anesthesia, contrary to what happens with fat. And then we extract 3 patches of 2.5 millimeters. We extract it as deep as we can, the subcutaneous cellular tissue included. If they were thicker, we would have to give a suture in order to contain that small bleeding. We've quantified 3 patches are enough in order to work on the whole zone that's affected by androgenetic alopecia. While we watch the video, I'll explain that. For many years, we are able to delay alopecia in a biological way, natural way, with an exchange of information that hasn't been demonstrated from a normal sensitive zone to a almost sensitive zone. This is a small device which is in charge of doing the mechanical degradation in just one use. We add serum and also the micrografts. The processing takes 2 minutes. And by doing this, we are able to obtain a cellular concentrate that's ready to inject wherever we want. We're talking about hair, but this procedure can be used to reestablish vitiligo, thanks to the what we found in the hair follicles. These are the 3 micrografts that we have removed, and we put them in that small device that's going to be in charge of doing the mechanical degradation, not enzymatic or with chemical, just mechanical. But this device, apart from disaggregating them, also, well, this is a Italian device, and it was invented by a dentist to extract the cells of the pulp of the teeth in order to do an osseointegration of the implants, because in Italy it's prohibited to use the PRP. So they designed another method in order to achieve this integration. This small mechanism disaggregates and filters the whole content, leaving all the connective tissue, elastin, all of the connective tissue is left in the upper part of the filter, and all the cells are filtered through 100 micron holes that are there. Once it's been processed in this rotor for 2 minutes, you proceed to extract the content. Two minutes are enough. So the whole visit lasts for 15 to 20 minutes. This is used in dermatology, in odontology, in vascular ulcers. This is held as an coadjuvant for the better repair of any type of injury. We're extracting the content that has been just filtered and processed by this small device. And now we add serum to have enough amount to infiltrate the zone where androgenetic alopecia is affecting the scalp. Some people feel comfortable with a certain amount to infiltrate subcutaneously in the superficial subcutaneous area and to reach the whole zone that's affected by androgenetic alopecia. So we add physiological serum to have enough amount to inject in the receiving area. Once we have the solution, we use the subcutaneous injection, and with this we finish the session. You have 1 minute left. The diagnosis is very important to see the evolution and the agents. There's a protocol where we know who's the ideal patient. The more micronized hairs they have during the effect, the best result they're gonna have. The microscopic study and the dermatoscopic study is of utmost importance. I'm going to show you a few cases where you can see that these patients are treated only with this procedure, where you dramatically delay the evolution of androgenetic alopecia. The patient that has been treated the most time is 3 years, and I don't need, or she hasn't needed any other sessions. It's more than 10,000 cases that have been treated all around the globe. Look at the quality of the hair and how much it improves as time passes by. Look at the length and the quality of the hair also improves. And androgenetic alopecia is completely delayed. There are some good and better cases, other bad cases, and this patient has been there for 3 years. It's also a coadjuvant of the micrograft. We've gone several times to Turkey to teach them how to make these micrografts to last more. Turkey, as you know, is the country that uses most micrografts, and when you go into the airport, you see hundreds of people that have received this surgery. These are the conclusions, and I don't want to spend more time from the next speaker. Thank you very much.